Hello, I'm Michael Hines, the Country Director here for Maternity Africa. I'm delighted to give you an update on how the hospital has done over the last 3 months or so, the first 3 months of 2023. One of the highlights was we had a number of women who previously struggled to give birth. A number of them had been pregnant 7, 8, 9 times and had miscarried during their previous pregnancies for a number of different clinical reasons. So our clinical team were able to provide them with the care and the support and the surgery and so forth that they needed, such that they could deliver, some of them even for the very first time, a baby for themselves and for their families, which was absolutely tremendous and a very, very happy time indeed for these women and their families. The first 3 months of this year, we're expecting around 600 deliveries, perhaps a few more than that, and we're also looking towards 50 to 60 fistula surgeries. In fact, we have a fistula camp underway at the present time, with about 35 women due to be operated on this week. The past few months have also seen an increase in the areas in which we've carried out outreach, mobile clinics and so forth. We had a trip recently up to Lake Natron in partnership with a couple of other organisations to investigate the needs there for antenatal care and fistula surgeries. It's an area in particular where there is very poor access to good maternal health. So we're looking forward to expanding that range of activities in the future, the number of the outreach that we do and the geographical diversification of those. We also had a 3-week fistula screening trip where our outreach team went up and identified quite a number of patients for fistula surgery to come here for treatment. Again, many for the first time that they'll have been treated anywhere. Other activities, our adolescent sexual and reproductive health and rights training and education program continues to flourish in 10 local primary schools around here, and also that has increased to radio broadcasting throughout the communities. And we also in February purchased 15 acres of land round about 500 kilometres from here in a very underserved area of Tanzania. So we're looking forward very much to starting to construct a second hospital on that site.
My name is Baraka Maziku. I experienced the nurse midwife at Kivulini Maternity Africa. A couple months ago, we had a program of being close monitoring for those mama who had BOH, bad obstetrical history, including they just lost 7 pregnancies. They never had a baby before, so they came in our clinic. Lastly, she had visited the last pregnancy. She had visited at Kivulini Maternity Africa, but also she was lost her pregnancy. But the last pregnancy, which is the current one, she was started earlier to come for ANC visit at Kivulini Maternity Africa. I was the one who was helping her, and there was 60 mamas who was in need, they have several pregnancies that was lost. So what we did for them, first of all, we had a talk with them to see what the problem and to dig more about the previous pregnancies and what happened for the previous pregnancies. Some of them, they said once the pregnancy is reached to the gestation age of 16 up to 22, they experienced of spontaneous labor pain, and finally they lost their pregnancies. But on our examination for their last pregnancy for today, they have their own child. We do diagnose that they had cervical incompetence throughout our monitoring during ANC clinic. So previously, we had one mama who she came in our facility. It was 2021. She had cervical incompetence, and we tried to refer her to Montreal, but she delayed to receive service, and finally she had an abortion. So she came again 2022 to our facility, and lucky enough we had a specialized service over here. We have our specialist, Dr. Mpise, and we do concern her. She had the same history and repeated again. So we do concern, and then we try to manage to have a cervical cyclage in our facility over here. And finally, it was successful. We did for 2 mamas, and all of them, they successful and they have their baby. So that is the great news. And the other one who has her partner, and the good news for them, they had a full cooperation for us. Even though there was some difficulties in language barrier, they do speak much Maasai language, which are mostly